Hi, I'm Maria Ulmer with Summit Behavioral Health. Let us take you from hope to healing. On this channel, we'll be talking about health and wellness. If you're new, please consider subscribing.
Maria, how could someone possibly find themselves addicted to prescription drugs, and how does Summit help someone detox from a prescription drug addiction?
Oftentimes, this is just found very innocently, where an individual has been prescribed a medication, a narcotic, Oxycontin, Vicodin, where that would typically be prescribed by a physician for an ailment or condition, such as a surgery, an injury, back pain, arthritis, and begin to take one of those substances with the feeling that I'm taking it because I've been prescribed. But soon enough, with regular use, the body begins to build a physiological dependency on that substance. And so the symptoms that you were originally trying to treat, pain or discomfort, now aren't being treated well enough with the dosage that you're taking, so you begin to take more and more, the tolerance builds. And before you know it, you're physiologically dependent on that substance. So it becomes a very rapid, quick cycle that starts with, again, an innocent request for medication or being prescribed by a physician to treat something that's an everyday ailment for many people. I've fallen, I hurt my back, I was playing basketball, I hurt my knee, and then we find ourselves in a hole that begins the dependency process. At Summit, we really look again at the individual's needs, assessing what that history has been like. Have there been a history of symptoms or behaviors that have been present before this existed? That's often really important to know, so that we understand the pre-existing the outline, basically, that the individual presents with, how they've been able to manage with these types of symptoms before. Is pain management going to be an issue that we need to address moving forward as part of the treatment plan in the treatment process with us, or when they're referring aftercare, considering what type of treatment options will be needed. So it's important that we're looking what was history presenting before this injury or before the substance use or abuse began, as well as now what is present. So we're really encompassing the whole history and presentation of the individual, and then moving forward with a treatment plan that's suitable.
So you shared a patient or an incoming patient may be struggling with, am I actually addicted to prescription drugs? What is kind of a telltale sign that, you know, I've possibly crossed over here?
That would be where an individual can't function without having that substance in their system. Again, it takes more and more to be able to feel that baseline, I'm okay, and that is that indication tolerance. So if tolerance begins, meaning I need more to be able to get the desired effect, that's one true indicator that this might not be just a typical use of a prescribed medication. It might mean that my body is needing more. Again, which is a natural response to these opioids. The brain is saying, I need more, it's not enough. And so the receptor is asking for more to be fed. So what begins to happen, an individual identifies as I need more. When they don't have that medication or they can't acquire it, they will then begin to have withdrawal symptoms. Withdrawal symptoms are very uncomfortable. For opioid specific, you typically would not be at risk of fatality, although you feel like I'm going to die. This is very uncomfortable. It's typically flu-like symptoms. And so an individual would have lack of appetite, chills, aches, pains, vomiting, diarrhea, overall not able to function and get up out of bed. So they'd be looking to seek having more opioids to fill the system and feed the receptors so that those symptoms would dissipate. And then that often leads from prescription drug use to more significant heroin dependency. More accessible, more available, and cheaper. What are some of your ideas? Please comment below.